When I was 5 months pregnant, I noticed that one of my breasts was much larger and harder than the other. And after some testing, it was determined that I had inflammatory breast cancer. And I was, of course, very worried about being able to have a healthy baby and also get treatment for my own very aggressive cancer.
One of the most important things for me to do was to be able to feel as though I knew what was going on and I knew what was coming down the pike in terms of cancer care, so that I could help Anya with making decisions about her care as well. There were so many oncologists around who were just writing, and doctors who were just writing Anya off. All of them wanted her to terminate because they knew that I was going to be a single father, that she had no chance, and they didn't understand why she was going to keep the pregnancy going.
I said, why would you want to be a single father?
Yeah.
And I felt tremendously angry that this had happened to me when I was pregnant, which was supposed to be such a happy time of life. But what changed my life was to ask, why not me? And then I thought, why not me? Why, if this has fallen to me, then what I can do is to try to live with cancer in the best way I can. And that means that I kept working. I was very honest with people about it. I remained hopeful. I remained very aware of changes in the research. So I did a lot of research on my disease. Luckily, the research showed that chemotherapy does not cross the placenta, so I was able to immediately begin my own chemotherapy while continuing with my pregnancy with Noah. And although I was induced a month early to give birth to him, I had a perfectly healthy baby boy after all the treatment. I think I'm happier now because I have a better perspective on my life than I did before I had cancer. I wouldn't want to go through it again. I wouldn't want somebody else to have to go through it. I'm not being naive about that, but I do think that it taught me what was important, and it gave me a greater perspective on life.